Hi, I'm Heidi Otway, your host for this Conversations on Cannabis virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about marijuana abuse, the effects of cannabis use on the developing teen brain, and some of the devastating risks when young people get high. So let's talk and learn about this from our panel of experts. Dr. Miriam Mandel is a board certified pediatrician and wellness coach who specializes in the teenage brain and how various drugs, including marijuana, affect brain development in young people. Dr. Mandel, welcome to the forum. Tell us more about yourself.
Thanks, Heidi. Hi, I'm Dr. Mandel. I am, as you said, I'm a board certified pediatrician. I am not currently working in conventional pediatrics anymore. I broke away from that about 13 or 14 years ago now, and I started doing my own independent research. I talk a lot about the teenage brain. That's kind of like my go-to. I teach in the community around where I live, at the schools, do professional development, and I do a lot of one-on-one coaching with adolescents. I talk a lot about the normal teenage brain. So I've always had that interest. Either, it started with in medical school and residency, it was like the teenager and the infant were my two favorites. So I kind of stuck with the adolescents, and now I have two of them myself.
Okay.
So it's been a nice tie-in.
Okay, good. Looking forward to learning more about your subject matter expertise. Our other guest is Dr. Sophia Lynn, an emergency medicine physician who is also qualified by the state of Florida to recommend medical cannabis to patients. Dr. Lynn, welcome to the forum. Tell us more about yourself.
Thank you for having me. Name is Dr. Safia Lynn Lassiter. I have a company called Ask Dr. Lynn that is licensed to prescribe medical cannabis for patients in Florida and Georgia. So primarily, I've been working in Florida for the last 10 years in emergency medicine. And over the last 6 years, really started my company out of need and necessity. We became legalized in the state in 2016. And so many patients were like, where do I go? What do I do? So they were yearning and desiring more information about how to have a more natural homeopathic approach to their health and take autonomy of their situation. And they really wanted to, step away and minimize their use with benzos and narcotics and opiates. So I was happy to be able to offer an educational platform. And through that, it's given me a great opportunity, nationwide to be able to talk about the importance and purpose of plant-based medicine, specifically cannabis.
Great. Well, it is so good to have both of you on this show. To everyone joining on this live forum, please share, post, and tag a friend on Facebook to have them join this conversation. If you're on YouTube, share the link so others can join us as well. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have our guests answer them. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comments on YouTube and Facebook after the live program. Your name will be entered into a drawing on February 10th, 2023 to win a $100 gift card provided by one of Mary's partners. Now let's start this conversation on cannabis. So both of you started your career in other fields of medicine before moving into the cannabis space. And Dr. Lynn, you kind of touched on it a little bit in your introduction. So I'm going to go to Dr. Mandel. And what prompted you to start researching the impact of cannabis use on the teen brain? Dr. Mandel.
Well, like I said before, I was always very interested in what was going on in the normal teenage brain, because there's so much going on in the normal teenage brain and when I say actually adolescence, so when I say adolescence, it's really from 12 or puberty. So like the onset of puberty until about 25. That's what the research is really telling us now. That's changed, but it's about until 25. And so I started to get into the nitty-gritty of what was going on in the normal development. And it's a lot of times people don't realize that just like when their babies are developing, the babies go through a very kind of methodical development where, most babies will cruise when they're 9 months, and then they start walking, and then and it's the same thing that happens with the teenage brain. It develops from the back to the front and from the inside out. So when you really start to see what's going on, and I was getting some clients that were starting to use marijuana and starting to start vaping at like 11, 12, 13 years old. And I really started to, and knowing all the things that are going on in the normal teenage development and how it's really it's a huge construction site going on there. And there's, right, I mean, like their personalities change, and they're always upset, and they're angry, and they're irritable. And, you know, we used to think that it was more because of hormones, and now we're realizing that it's more neurological. The brain changes that are going on are so intense.
Mhm.
So when I started doing some of the research and getting some information from my vaping and my marijuana users, young kids, I really wanted to know how it was correlated and what was going on with each different stage. And it was just fascinating to me. And it's almost like when you understand how complex it is in that area of that development, it's almost like a no-brainer, because these components in marijuana can be neurotoxic to our cells. And when they're going through the huge amount of change that they're going through, it's just kind of screwing that up. It's screwing with that. So things
Mhm.
can't work as normally as it can't work normally as they would.
Mhm. That's really interesting. Dr. Lynn Lasser, do you want to add on a little bit about, you know, the motivations for you getting into cannabis, other than you having patients saying, hey, tell me more?
Absolutely. So with my background in emergency medicine, especially in South Florida, where I see a variety of patients coming through the door at any given time, we are a tourist state. So we have a lot of raves, a lot of concerts, a lot of big events. And throughout the years, I started to see a lot of younger patients really overdosing with designer drugs. And designer drugs are compilation drugs. They're not just straight cocaine or straight crack or straight heroin. It's usually a combination of fentanyl, ketamine, and other, you know, drugs that have been just abused to the point that it depresses your respiratory system, causes cardiac arrest, and minimizes your ability to be able to function on your own without any external life support. So being in that position and realizing that I couldn't bring some of those young patients back, and I started to make the calls to family out of state and notify them, you know, I know your daughter came down here for spring break, but she's not coming home. She's passed
Oh my
away.
God.
This is why. Those started to have an emotional impact on me. And I really was motivated to figure out, okay, greater than the fact that you're actually, you know, using these beyond recreational purposes, is there any underlying medical need? What is the underlying stressors that's magnifying your intention behind while you're using? What else is going on? So as I started to talk to more and more patients, like, hey, why do you use? Just general conversation, you know, that really led more into my research about, okay, there's a lot of undiagnosed mental instability, including depression, including stress, PTSD, anxiety, things that we don't realize we're medicating for because we haven't been formally diagnosed, because so many people stay away from the doctors due to that fear, due to that mistrust, not having a good relationship with your physician. So all of those factors, you know, really prevented them from being formally diagnosed, but not realizing you're medicating with a purpose and intention. You just haven't been diagnosed yet. So unlocking that truth for a lot of patients allowed them to see, oh, wow, like there's a way to do it under guidance with a minimal amount of product to achieve maximal relief, right? So that's my entire motto. Not only is it expensive because this is an out-of-pocket cost, it's not covered by insurance in any state, because remember, marijuana and cannabis is still federally illegal.
Right.
So there isn't anything to offset the cost. It's really, you know, a cash business. I do try to really, really promote the importance of using microdosing, a minimal amount of product, because we want max gains, right? And we want to make sure that it's being cost effective so that we can lean into that process and encourage patients to continue to use when they qualify, when it's been substantial for them, and when it's been effective.
Right.
So that's really part of my motivation, really seeing that and being involved, you know, day to day with patients, that I just knew I had to do something greater. I knew I had to do something bigger. And my background coming from Jamaica, we've been involved in cannabis for several years. You know, before I even knew what was going on, my grandmothers were using salves to heal ailments, you know, different teas for stomach cramps and headaches. Those things have been infused in our culture, and it wasn't viewed as negative or illegal or anything like that. It was more of a spirituality and a healing component to it. So that was my first introduction to the plant. And now being in a position where I actually have the privilege of taking care of patients with this plant, let's do it in an organized form. You know, so I spend a lot of my time educating patients on the value of it and helping them to understand what we're going to do and the intention behind what we're doing. Everyone that I work with, we're finding the lowest amount of cannabis and weaning back and eventually eliminating any narcotic use, any opiate use, any benzo abuse. So that way we can make sure we're finding the purest form of treatment and isolating what's helping you best. So yeah, I have a sad story to start with, but I'm happy to be in this position. Here we are 6 years later to be able to educate more people about the importance and benefits of it.
Yeah, I'm glad to have both of you on for the background and the expertise that you bring for this kind of, heavy conversation about, young people who are consuming cannabis. And I'm not, and we won't touch on the medical cannabis because, to your point, Dr. Lynn, it's regulated by a qualified physician if you're in Florida and also in other states. But I want to go back to the motivators of, cannabis use is becoming more mainstream, especially on the recreational side, which could, make it more available, the recreational adult use, which is not legal in Florida. You can still get it on the street and it's illegal, but, what would be the motivators for them to use it? And Dr. Lynn, you touched on it, anxiety, depression, those kinds of things. So I want to go to Dr. Mendel and kind of have you tell me, what are you as the reasons that young people are turning to cannabis use, not medical, but the street form of cannabis?
Yeah, we like what Dr. Lynn and I are seeing like two opposite spectrums, which is kind of cool, actually. I mean, I'm seeing young kids that are, 11, 12 years old starting. I tend to see it more in my population. They start with the vaping. And then the vaping, it's almost like, especially now, it's like a natural progression, a simple, like no-brainer. These kids are going to start using marijuana. Like, why wouldn't they almost? They're just getting such a, they're getting the information and the kind of the feel that marijuana is, there's really no problem with it. It's safe. It's used for medicine. And it makes you feel good. But what I see generally is these kids that are coming in, not even knowing that, starting with the vape, not even knowing that there's something that's addictive in there, the nicotine. They don't even know that. They think they think that they're just vaping like a flavor, So it's more like, I see more peer pressure, and I also see some anxiety, some of the older teens that are doing it. And a lot of the anxiety, believe it or not, I mean, I see it a lot in sports. Like some of my kids, I have a lot of like kids that are like D1 athletes that are, that are going or being recruited, and they're either get an injury or something where they're getting some kind of pain relief. They would actually starting with the vape, they get like a little bit of a buzz. It kind of makes them feel good.
And
then
we're talking about regular vape pens, not the tobacco related, not the ones for cannabis. Or
this is just regular. That's how it seems to start.
Okay.
They get a little bit of a buzz from that, just from, because it gets into their nicotine, gets into their blood, into their brain so quickly, like within 30 seconds, they're getting kind of like a rush, lasts for a couple minutes, and then they realize it's not enough, and that cannabis can give them a longer duration of pain and anxiety relief, right? So a lot of peer pressure, a lot of just kind of natural progression, pain. Those are the main things that I see, and anxiety. Every kid that I see has who doesn't have anxiety these days, right? So it's just like, it's a problem. That's what I'm seeing.
Dr. Lynn, did you want to add on to that?
Definitely. So when we talk about mainstream, we got to talk about culture, right? So we're talking about the music, we're talking about the access. We are discussing peer pressure, coping with undiagnosed stress, all of those things. Culturally, you see cannabis infused everywhere. Television, Netflix, streamlining, music, all of those layers that our adolescents are inundated with daily. You can't look at a billboard without seeing an advertisement for CBD or THC. You can't, click on Hulu without having pop-ups for CBD and THC. Recently the Super Bowl had one of their first commercials regarding CBD and THC last year, right? So we're seeing that infusion in our culture on a daily basis, and that repetitive sight and vision becomes embedded in you, right? So even if you are not conscious or aware about what you're actually seeing subconsciously, it's inside of you. Every song, every hip hop song, every cultural, norm, whether it's country music, whether it's rock, whatever it is that you listen to, there's an underlying, tinge about cannabis, whether it's you should use it, this helps me, this is what I do. So when the people that they idolize and their role models are using it nonchalantly and recreationally, it's like, oh, well, let me try this. It's popularized. So
Yeah.
popular equals culture, and it affords patients the opportunity to believe that this can be done anywhere, not realizing there's only 37 states in the United States that have medical available use for cannabis, and there are 21 recreational states. There are still states that have absolutely no rules on hemp, THC, or CBD, and it's illegal, to take your product in that state and try to use because you're not abiding by the state regulations and laws. So I'm always aware and educating patients of the importance of that. No, just because you're in Florida, you can't run over to Louisiana and do the same, things that you would here, because every state is individual on how they practice and what the decisions they have decided to allow for regulations in their state. So it's important that we speak individually about each state and make sure that patients understand the parameters within that state. But the actual key to me that I see in a lot of my patients, young adults specifically, because I personally prescribe for 18 and older only. But the reason why I do that is because there are ramifications of being an underage patient, less than 18, and being positive for THC in a drug screening test. Some of those ramifications include, say you're applying for one of those D1 scholarships for a school, say you're playing ball, say you're playing, football or soccer, and you happen to get drug tested randomly or intentionally, your THC will come up positive depending on the amount of use you've had in the last 90 days, because that's how long it typically stays in your system, depending on how chronic and active you are as a user. And that can put you in jeopardy for losing that scholarship, regardless if you do or do not have a medical cannabis card from your state, right? So all of those things have to be thoughtful. And when you're getting ready to prescribe for a patient that's 18 or less, and even someone I talk to now who is attempting to apply to be a firefighter or a paramedic or anything in the healthcare field or government or police officer, you will be drug tested. So I always have these career discussions with people, like, what's your intention? What do you want to do in your life? Where are you going? So that they can be aware of how to make sure that they either stop or decrease their use if it puts them in jeopardy of losing their career.
Oh my God, I want to unpack what you just said. I've been writing some follow-ups that I think both you and Dr. Mandel can touch on. So first I want to go back to Dr. Mandel. You said that where you're seeing people using, the gateway for young people to use cannabis is through vape, right? So Dr. Lynn, you talked about, you see it everywhere. You're seeing the billboards, you're seeing, all these things. Now in Florida, I travel up and down the state of Florida all the time, and all I see screaming at me is CBD. So the Delta 8, the Delta 9, all these CBD type products, now there's CBD beverages. Do you all see the use of CBD as a gateway for the more potent stuff? And again, I'm just thinking back to, like you said, the vape or, those things. What about CBD? Because it's so prevalent.
I personally don't. I don't think kids are that interested in CBD because there's no
Not edibles, gummies.
Well, there's no psychoactive component to that, so they're not going to be interested.
Okay.
If you're
All
using
right.
it for recreation, right? These kids want to get high. They're not doing it. They don't understand. I don't think what that really could be used for, or they just want to get high. So
Okay.
that's just my population.
Right. Yeah. And that's why I said I would love to. Yeah. I'm sure you both have different perspectives, but you can't, I have to address CBD because I even see it within the young people in my circle, look, I got a CBD gummy. I'm like, you're not supposed to have that.
Yeah.
So,
And just because it doesn't have psychoactive effects, there are definitely
right.
biological effects.
Where'd you get that from? Amazon? What?
Right. Yeah. You can get it anywhere. You can give it to your dog, You give it to your birds. You can give it to anybody. It's in
Right.
everything.
So
Dr. Lynn, you're in Florida. I'm sure you see all the signs.
CBD has anti-inflammatory properties, non-psychoactive properties. So it doesn't cause that euphoric effect that THC has, right? THC is the one that you need to have your medical cannabis card in the state of Florida to be able to purchase. CBD, I can walk into any dispensary, any gas station, any Walgreens, and purchase CBD. You can get it on the internet, and it's available more through the legalization of hemp, right? So through that laws and guidelines, CBD was able to become more normalized, popularized, available, and legal and accessible. THC still has its own separate pathway because it does have a higher potency of marijuana, and it does cause that euphoric feeling depending on the percentage of THC available in the product that you're using and the tolerance of that person who is using. So because of those, potential effects of it, you do have to be a qualified medical cannabis patient in the state to be able to purchase. So two separate things. Do I think CBD leads to THC use or begets other medications as a quote unquote gateway? No, I agree with Dr. Menzel. No one's coming to my office asking for CBD, right? Because CBD is so available. They're coming to me because they want to have access to THC. And the reason why I educate them is I love the holistic and components for the entourage component of the both of them working cohesively together. So I do a lot with hybrids. I make sure that every patient that I prescribe THC to has access to CBD as well. And I inform them of the potential for both of them working together to create an even greater improvement in your homeostasis and health, because you have the anti-inflammatory component through the CBD, and then you have the pain relief from the THC. So depending on our intention and what we're trying to accomplish together in our patient and doctor relationship, I make sure that patients understand the value of utilizing both.
Yeah. So I want to go ahead. Dr. Mandel, did you want to add something to that? I can see.
Just that I think it's real important for the audience to know. I get so many questions on this too. Is like, it's not that I'm here because I'm against marijuana. Like, I feel like as an adult, once you're 25, you can do what you want. And there's a lot of times that certain patients can really smoke it recreationally with very little, toxicity or any problems. My thing, it's not even so much that I just think education, just like Dr. Lynn, like education is just such a crucial component because these kids have no idea, right? Their general understanding is that you're going to smoke and you're going to chill out. And sometimes that happens, but sometimes it doesn't. And sometimes these kids get a lot paranoia. I see a ton that a lot of times they'll come to me. The actual kid will go to their mom because they're scared to death of something that happened. They're hallucinating or they're having intense paranoia, and they want to speak to a doctor because the kid wouldn't necessarily want to at that point speak to a coach. They want to know that they're okay physically. So sometimes these kids come to me because they're scared, and they're scared that these effects are not going to go away. And honestly, will they go away? Probably, but can I say 100% that their brain fog is going to go away? I can't. I mean, I wish I could, but will it? It depends. Like we were talking, like the concentrations now are so high. Where are they getting it? Are they getting it from a concentrate? Are they getting it from the plant? Are they getting it from where are they getting it? Sometimes they'll steal it from a brother or a sister that's doing medical marijuana. Yeah, they take or their brother and sister will give it to them. So they're vaping it or they're smoking, whatever they're doing. But it's not the same product as it was when a lot of these parents have this laissez-faire attitude about letting their kids smoke because they do. It's a completely different story when you're an adult smoking and when you're a child. And that's the thing, like these parents don't understand. They're not doing it intentionally. They just think it's just weed, big deal, but it's a different product that like what these kids are getting on the street and what they're getting at school, wherever they're getting it. The THC concentration, even just in regular, the plant is the way that it's grown. It's about 3 or 4 times more than it was back in the 60s, 70s.
Right.
And now they're getting these concentrates, these little, crystal or semi-solid concentrates that are, and that's where people are getting into trouble. They're smoking
So when
these.
you say getting into trouble, is that a good segue to talk about cannabis misuse in the, I wouldn't say addiction, but just the abuse or the misuse of cannabis in young people?
Yeah, well, that's the only type I see. Dr. Lynn sees it more on the, being monitored and using it for, being under a doctor's care, whatever. I just see it in kids. I'm seeing
Right.
it.
So in the kids that you're seeing, are they abusing it? Would you say
Well,
that they're abusing it?
Abuse is a word they don't. I mean, this is from my understanding. We don't really necessarily like to use the
Yeah.
word.
What would be the term? Yeah. Tell me.
But like
Dependency?
like a disorder. I mean, a lot of people don't like. I mean, there's going to be people who don't like any word. But basically, when they're in a situation where they're using a substance and it's affecting their life in a way that they either want to stop, they can't stop, it's affecting their life, their school life, their parent life, their with their parents, and it's causing a lot of distress, and they're not able to stop.
Mm-hmm.
So that is really how you would. I mean, there is a whole. It's in the DSM as a disorder, a cannabis use disorder, when it gets to that point. But when kids are using it, a lot of times, again, I'll see also kids that the parents are calling me crying or upset because the kid is acting irrational, really irritable, violent, and because these kids are going through withdrawal. And that's what happened during COVID. They weren't able to get to school to get their supply. So these kids were home. They couldn't get out. A lot of them don't drive. Like these young kids are not driving. They weren't able to get their stuff at school, and the parents were freaking out. So, I basically work in my community. I really only see people through word of mouth. That's really how I get a lot of my clients.
Mm-hmm.
And so that's what I was seeing. These kids were just fighting. They were hitting their brothers and sisters, things like that, because they're going through a withdrawal. So there is a withdrawal. People would argue and say, well, it's not physiologically addicting because they're not dying if they don't have it. But in my book, that doesn't mean that it's not, physiologically addicting. There's definitely things going on that when it's stopped, when the use has stopped, the body has to revamp because it's missing it, and it has to regulate. We just want to get to homeostasis. Our body is always wanting to get to homeostasis. It wants to get to that equal level. We have a whole cannabinoid system in our brain, very, very high in adolescence. And when that gets triggered, we have these cannabinoids in our brain that are naturally created, but it's kind of like you have a receptor and then the cannabis will touch it, right? And it will do its job. But when you have THC at these high concentrations, it's kind of like it's like a hammer, right? There's such a strong affinity, much, much stronger, like a 1,000 times stronger affinity to that receptor than our endogenous cannabinoids. So when you're taking that away from our body, when the body becomes kind of dependent on that, then you're taking it away. There's going to be repercussions in how you're going to feel, how you're going to act, your state of mind, your irritability, things like that.
Dr. Lynn, I can see you want to respond to that. Please add to that.
No. Amazing, loaded information. Absolutely. So let's really succinctly define what is cannabis use disorder. So cannabis use disorder is the inability to stop using cannabis even though it's causing health and social problems in your life. What are some of the side effects that we see from cannabis use disorder? Irritability, appetite change, restlessness, mood, and specifically sleep and insomnia disorders. So those are some of the most common side effects we see with cannabis use disorder. It's estimated that about 30% of patients will develop cannabis use disorder. And it's dependent on something, whether it's caffeine, whether it's cannabis, whether it's another pharmacological drug. Anyone who's dependent on something, when you abruptly stop its use and access and availability, your body does alter and compensate. And some of those feelings are manifested with the irritability that we saw in the kids during COVID without having access to their, cannabis and stuff like that. So those side effects will manifest, and that's with anything that you do as a daily habit, a daily use, as your body's adjusting to not using, especially if you go cold turkey. So one of the important keys when you're starting to recommend cannabis for patients is I never stop any patient blanketly on any of the medication that they've been using for years. There's always a weaning down process. And what we're doing is we're slowly introducing cannabis so that we can start to increase our cannabis use to the minimal amount. And we're starting to decrease our use of other medications that we're trying to get off of. So it's a balancing act because, of course, like Dr. Mendel said, the goal is always homeostasis. Speaking to the potency of cannabis, yes, it's increased significantly because we're able to genetically alter its potency. So cannabis today is, what did they say, 17 to 28% more potent than it was previously in the 70s and the 60s. And that's referring to the JAMA pediatric article with Association of Cannabis Use and Self-Harm and Mortality Risk Among Youth Mood Disorders. So that availability of a higher THC potency, it's important that you're very thoughtful, specific, and intentional when you're recommending cannabis, because you have to understand the tolerance, the experience, the time of day that patients are using it, the method of delivery. Some methods will have faster onset of action, like doing vape, because it's going more into the lungs, or doing tinctures, which go sublingually, as opposed to an edible, which might take a few hours to kick in if you recently had a high fatty meal. That processing through your gut has a more delayed onset of action than some of the other delivery methods and techniques. So those are all important conversations for patients to understand. I love the availability to use all the different methods to layer its use when appropriate for the patient, but I also help them to understand different times of day with different intention and different purpose and availability. You're not going to pull out a joint when you're at work outside on your smoke break, right? That's not the way we medicate. We're still being thoughtful of where we are, checking that we're on a corporate site, and making sure that we're following those regulations and guidelines, right? So we want to always be intentional and educational about their ramifications for doing these things on certain locations that do not approve cannabis use. And I tell patients all the time, okay, you work for Apple, you go to the headquarters every day, no problem. Just because you have a THC card and you're allowed to use it in the state, your corporate entity might not respect the fact that you are a medical cannabis user, and in their handbook and drug guidelines, that's not appropriate for their facility, and you is grounds for termination. So all of these conversations are really, really critical to make sure that everyone understands that we're embarking on a journey together. It's going to be an amazing, beautiful journey when it's done properly with the greatest and most effective intentions. But you have to know, the potential ramifications. And I can't emphasize that enough, especially for teens, especially for adults that are still, working corporately.
Yeah. So I want to switch to, the overarching topic of today. We kind of working our way to, this heavy subject of young people having suicidal thoughts from the use of cannabis. And, we've seen some research and studies. Let's kind of dive into that and kind of talk through what causes that. Dr. Mandela, I want to kind of start with you. In your expertise as a counselor, health coach to young people, are you seeing that?
Yeah, I do. I've seen it. I mean, now I see, sometimes the child will take it for anxiety, right? And
And it's not legally. This is not, they're
this is
doing it
not legal, right?
illegally.
This is illegal. They're starting to use it for anxiety. And one of those things that people don't realize, depending on their state of mind, depending on the potency of what they're getting, where they're getting it, why they're doing it, whether they have a history of depression or not, what happens is after a while, like we've talked about, like your body starts to get regulated to this. And then when it's not there, it's craving it or it's wanting it. It's not able to, it's not the cannabinoids that are being created endogenously are not going to be working as effectively. So what happens is there's like this slow creeping depression that will start to come and manifest. Usually they have done studies on this. I don't have it with me, but there are definitely very good peer-reviewed studies on this, and recent studies that show that this underlying depression that's coming on is being considered from daily use. Daily use is basically about 300 days a year. So it's not necessarily every single day, but it's almost every day where these kids are, or adults too, this is for adults too, they're getting this slow creeping depression or anxiety, even if they don't have depression and anxiety before they're using it, or even if they take marijuana and it's causing them a decrease in anxiety, after this chronic use, it will start causing a slow creeping anxiety and or depression. So of course, we know that there's a much stronger correlation between suicide and depression. And now remember, it's not like saying that marijuana is a cause of suicide. It's correlated. So there's a link, and that's why they do research, right? To find out what that link is. So that I believe from what we know about depression and how it correlates to suicide, that could be a correlation there. There's also some evidence or some research showing that there is a genetic link in chromosome 7. I don't know. Again, it's a correlation. This was found through research where they looked through charts, they did postmortems, they looked to see, and they found it consistently with a large population that there possibly could be a genetic link through chromosome 7. And then, of course,
did it matter the ethnicity of the person? This particular piece of the study, did it talk about whether it was more prevalent in young Black people or white people, or
I don't remember. I don't remember them talking about ethnicity.
Okay, I was curious. Okay, thank you.
Yeah, I do know a lot of the studies show that with this link, the younger they use, the stronger the correlation. So there is if kids are starting to use under 15, there is a stronger correlation. They found that young users, young females, there's a stronger correlation of suicide, ideation, talk, plan, and suicide as an adult. Okay, so this is not something that you're going to necessarily see right away. Like these cannabinoids, they work on something called the G protein. This is not something where they smoke and then it kind of opens the door and things are happening right away. Some of these things are way downstream and it takes a long time for it to come into effect. So that's the correlation that, and this is just it's really a hot topic, and it's like, there's some ethics involved here too. Like, what if there is a chromosome that, say, is more correlated to suicide? Is that something that you're going to want to know? Are you going to want to know that your kids have that or not? I personally think, just like with alcohol, when you have a predisposition, you can be more educated, you can take more caution, you can know that you're going to be at higher risk. So it could be very helpful. So just some things to think about. Now remember, marijuana is not federally, there's no federal. So since it's not legalized federally, it's going to be limited in what kinds of studies that are going to be able to be had. It's very hard. Supposedly, it's very hard to do a lot of these studies. I'm sure Dr. Lynn knows a lot more about that than me, but to be able to get regulation, it takes so much time because it's not federally legal. So again, like it's like you said, I love how you said that. This is a journey we're all on, and it will, if we can kind of work together and just educate ourselves on what's going on, I think we'd all be better for it.
Dr. Lynn, did you want to add to that?
There are no statistics to support there is actual marijuana causing suicide. And even in the most recent CNN distribution of information, there was an article that we discussed regarding marijuana abuse by youth with established mood disorders linked to suicide attempts, self-harm, and death. In the summary of that article, Dr. Gonzalez, one of the main contributors, said that it does not prove that cannabis use causes depression or self-harm, but it doesn't definitively refute it. So you mentioned, Dr. Mendel, about correlation versus causation. I think it's really important when we talk about causation, especially scientifically, we have to have facts, we have to have statistics. So while we can discuss the correlation between the two, it's important to understand that a lot of this research has been done on patients who have an established medical condition, including mood disorders, most prominently bipolar disease and depression. In that JAMA article where we discussed the pediatric patients, you mentioned the cohort. What did that look like? Yes, the popular group that had the highest impact was Black youths, age 14 to 18 years old, Black male youths with a history of bipolar disease and depression. So when you take that as your study population where you're seeing the highest risk factors and causation, let's backtrack that. Let's talk about the trauma that these kids have been to. Let's talk about what they've been exposed to. Let's talk about what they're dealing with on a daily basis, in their environment, in their impoverished situations. These are polled statistics from the Medicare population in Ohio, and they were made through Medicare claims. So it was a retrospective cohort study that looked back at some of the identifying DSM codes for these youths, age 14 to 18, in Black males.
We want to share those links definitely with our folks online. And then we did get a question from someone asking about the role trauma plays in teen use of cannabis, specifically Black and brown teens. So you just kind of answered that question. So thank you. But so for everyone's listening and watching, we want to share those links. And, earlier when we were prepping for the show, we talked about what are good resources, since there isn't a whole lot of research out there. What are good sources where people can go and get credible information about this topic? Dr. Mandel, you mentioned a couple places. Dr. Lynn, as you as well. So you all want to share where folks can get some information?
Yeah, I think we both agreed that the National Institute of Health, the National Institute of Drug Abuse, which is through the National Institute of Health, they have a great search engine there. Everything is up to date. It's real easy to use. So
those are our straightforward scientific houses for information. Another website that's great is mine, www.askdrlynn.com. You can DM me, you can email me specific questions, always accessible to patients for, questions to help them navigate where they might feel a little bit more intimidated by some of those other sites. They might be a little, overwhelming to read on a first kind of notion. You might need to backtrack it a little bit and kind of break it down to our level where we can discuss it. So that's why this platform is important, because we're having real conversations with real topics, with real patients in the chat asking questions.
That's awesome.
To make sure that we're doing this and we're being very specific and identifying recreational Black market cannabis versus recommended medical cannabis, which is what I prescribe, So we don't want to intertwine the two, because there's a very distinct market between the two. And a lot of that has to do with access and intention. Because the Black market does have the tendency to be laced with other products, including cocaine, ketamine, fentanyl, and other processes, we want to make sure that we're not speaking to the recreational use that some of those people have access to. We're talking about the importance of the medical plants and how we're prescribing it, and making sure that it's used in the terms and fashions with the appropriate intentions and guidelines. So yes, a lot of patients, I'm sure, present to you, Dr. Mendel, with their first access, which is recreational market Black cannabis use. But a lot of that product is cut manufactured and laced and not properly grown or conducted, and it's not in greenhouses, it's not, laboratory tested, and they don't see the percentage of THC on the package that they're getting
Yeah,
from
absolutely.
a dealer, right? So we want to make sure that we're always being thoughtful and distinct to our audience to understand that, my emphasis and my teaching and education is about medical cannabis. And I speak to a lot about what has led recreational users to become medical cannabis users during the time as we're seeing greater access and availability within the states now. So
Yeah.
I'm happy to help patients make that legal transition and help them to create, a usage that can help them to achieve their goals and use minimal amount of product.
Yeah.
Yeah.
I mean, I have friends that use it for IBS, for pain. And I think it's great now that, they can get it legally. They're in New York. And yeah, so is that website that you have, just out of curiosity, because I think I'm going to use it.
My website.
Does that go right to you? Like, do you answer those questions?
Yeah, so that's my platform. Ask
Okay,
Dr. Lynn. I've been
awesome.
growing it for the
Yeah.
past 6 years. Initially started in Florida, and now that Georgia has become legalized, I've started to qualify patients in Georgia as well too. So it's a great resource. It's a great wealth, and I think the most important thing about it is it's easy to read. It's accessible to everyone, and I want patients, and especially my young patients and my teens, to not feel intimidated by the information that's out there. So if they start reading something a little bit too heavy on the medical side, they'll pull back and they'll be, deterred and not continue their research and their investigation. So if you just have a general question, throw it in the chat, make it easy. We're happy, we're here, we're available to answer all of our patients' questions.
Yeah.
Also, I'm sorry, this was just, I think this is such an important thing though. I have this, like some of these kids and because just kind of maybe to end on a more positive note, some of these kids that start vaping and doing marijuana, and then they'll come to me because they're scared or whatever. They actually turn their lives around and they become the advocate at the school to stop. It's like these kids, like they understand now. I mean, once these kids understand what they're doing to their body and their brain, they don't want to do that. They don't know. It's the thing. That's the thing. They're just not educated. And once they're educated and you kind of get them to see what's going on, you're just giving them the truth. You're just giving them the facts, just like you do, like with these older kids and these adults. These kids can turn it around and they become the strongest advocates for their school to stop drugs.
So I think it's important to be clear. I think anyone who's had a negative trip or reaction to any medication, whether I prescribed amoxicillin and you started violently vomiting, whether I prescribed Percocet and you started hallucinating, whether you did use black market cannabis and you had a negative trip and became psychotic during that event, and anybody who had a negative experience with an interaction, some kind of chemical, some kind of drug, is going to turn around and be the advocate for it. Anyone who's had a positive experience, and I see much more positive than I do negative, thankfully, but anyone who's had a positive experience, they do become advocates as well too, and help patients understand. The greatest gift that I see in my office is when the grandparents start to educate the parents who now are bringing in their grandmothers and grandfathers who previously used back in the day or never used because of all the misconceptions about cannabis. And now they're coming in because they want relief for their nausea secondary to their chemo treatment. They want relief for their ALS, or they're trying to look for relief for seizure activities or different side effects that are associated with multiple sclerosis and things like that. So of all the qualifying medical conditions, we want to make sure that we are being thoughtful, but it is generational, it is cross-generational. And age-wise, we're able to really inform various audiences about the potential of plant-based medicine and help them to have more autonomy about their health. So patients feeling involved in the decision on how to care for themselves are more likely to be compliant with the regimen, right? So if I'm telling you, okay, let's start slow, let's go with low dosing, let's microdose, let me help you to create a regimen that'll be fruitful and effective for you so that you don't have to overthink it. Let's create a safety plan. If you do start to have side effects, use additional THC tinctures, which will help create a more balanced system. That way you can always call me directly. I'm 24/7. All my patients have my direct cell phone number to access, You know,
Mhm.
these safe methods to help patients to introduce cannabis into their medical regimen really are guides and barriers, so that way we can encourage them. If they qualify for medical cannabis, this is an option. I don't advertise. I don't, I don't do billboards. I don't do print. All of my patients come from word of mouth, just like you, Dr. Menzel, because one good experience and one engagement will
Yeah.
beget another, right? So
Great.
that's what we want to do.
Yeah.
Yeah. So, as we get ready to wrap up, I just want to encourage everyone that if you are in the state of Florida, we encourage you to visit the Florida Department of Health Office of Medical Marijuana Use to get information about medical cannabis in Florida. It's real important for you to understand the state law. So, if you're coming into Florida, please make sure that you know what you can and can't do when it comes to cannabis use. And I thought this was a very good conversation, really trying to get into helping young people understand the impact of cannabis on their brain. And I'm going to throw it to Dr. Mandela. Any closing thoughts from you, having worked with so many young people who have, experienced suicidal thoughts, or the research that you've seen where people have actually young people have taken their lives after using cannabis? Any closing thoughts for a parent that is listening to this show and they may be in a situation where their young kid is using cannabis? Any closing thoughts from you?
I think that one of the most important things for parents is to really start to really educate themselves. There's so much information out there, and it's so helpful. Be careful of the sites you go to. I think, as we said, the National Institute of Health or the National Institute of Drug Abuse are great places to start. Educating yourself, educating your kids when they're young, like in middle school, like that. They say that that's like the best time to get a kids really start to get them aware of what's going on and to talk about some of these things. Um, I love it when I work in the schools, and sometimes you just need one parent to be the advocate to get that talk to the kids, to the staff. Um, and, like we said, I mean, there's going to be good and bad to both sides, and it's not all good. It's not all bad. It, it's just in kids, there's a risk that people don't know. That's all. And it's about understanding what that risk is and letting your kids know. Like, I think a lot of these kids in high school and college, if they knew some of the risks that they're doing to their brain, how it lowers their IQ, it changes their concentration, it affects their attention. Like, these are kids that are in the developing brain. They wouldn't do it but they just don't have the education. They just don't know. So it's just about getting the information, and then they can make a more educated decision for their own life, especially when you're talking about kids in their 20s, their young
Mhm.
20s.
All right.
Yeah.
Dr. Lynn, did you want to have any closing thoughts before we wrap up today's show?
Absolutely. So definitely fruitful conversation. Hopefully more young children and teens and young adults tune in and are able to review the live that we're going through today. But I think the bigger picture is wellness. So overall understanding that there's many components to managing your health, your mental health, and your wellness. And cannabis can be one portion of it. But let's think bigger picture. Let's talk about coping techniques and tools. Let's talk about time management. Let's talk about stress management. All the things that are overwhelming our children, the conversations are epic and poignant. We cannot depend on the school for their 2-hour session on drug information to be enough to inform our students. That education and that information comes from the home, and it starts with the parenting. So when the parents reach out and pursue knowledge and information without being combative or condescending, and are able to have a discussion with what's going on when you go to these bat mitzvah parties, what's going on when you're in sleepovers with your friends. Are they asking you to drink? Are they asking you to use cannabis? Are they asking you to vape? Like, what's up? Talk to me. Those open conversations, and knowing that you have that lane to help develop discussions with your children, that provides a safe space for them to be able to invite you in and understand what they're processing and what they're dealing with. So I'm hoping for a greater expansion in our discussion regarding wellness and management and finding balance in yourself. And a lot of times, patients are looking to create an environment that, even as adults, they have been coveted with their use. They do it when the kids go to school with their cannabis. They want to make sure no one sells it on them. They want to make sure, and that shame and that guilt for actually using your own recommended medication to help manage your anxiety, manage your stress. When you change that narrative and your perspective and your value and how you choose to take care of yourself, that will exemplify and magnify and be, speak more volumes to children than it will from your coveted use. That opens up the dialogue for education about cannabis. So, for example, I have cannabis in my home. My daughter and my niece know that I use cannabis to medicate for my PTSD, right? Helping them to understand this is the purpose behind my diagnosis. This is why I choose to medicate and treat myself in this manner. This has worked for me. Telling them about potential side effects. They know exactly where it is. They see it, and they understand that this is mom's medication. This is mom's decision and my choice. And if someone wants to talk to you about cannabis or try to get you to use it, you got an expert here. Like, let's get into it. Let me give you the language. Let's figure out what's your comeback. So you're not taken off guard and you're not wide-eyed when someone says, hey, you want to hit the vape or you want to hit the jewel, you want to do this? Like, no, that peer pressure shouldn't stunt you. You should be equipped and prepared. So that way, when it does come your way, you don't feel taken off guard. Like, yeah, you know what? My mom's talked to me about this and really, I don't have a need for it right now. Or if I do need it, I'll be able to reach back to her and get more information. But yours, I don't want to write yours, So that way, I want to make sure that this dialogue is open. This dialogue is received well, especially amongst our teens, because oftentimes we're speaking in one ear and it's going right out the other. I know my daughter's 13, so she has that same demeanor sometimes, and I want to make sure that we're providing a sense of safe space and comfort for our teenagers and our young adults to be able to ask the questions that they need to ask and get the information that they need. So wellness in the broader picture is more important to me, and I'm hoping that our conversation today helps to support that for all of our patients and students.
Okay. Well, Dr. Mandel and Dr. Lynn, thank you so much for being guests on our Conversations on Cannabis virtual forum, brought to you by the Medical Marijuana Research and Education Initiative at Florida A&M University. Thank you to everyone watching this program. Tell us what you think about this forum by completing the survey that will be posted in the comment boxes on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on February 10th, 2023 to win a $100 gift card provided by one of Mary's partners. We also want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn how to obtain a legal medical marijuana card in the state of Florida. And we also encourage you to go to the Florida A&M University's Mary website to learn more about this initiative, its educational programs, and additional information about cannabis use in Florida. Thanks, everybody.
Thank you.
Thank you, Heidi.